Hey, it's Dr. DeCubellis here. I want to do a quick hot take. One thing that I have been looking at, going over different research articles, and one thing that keeps popping up, and I thought was very common knowledge, but you know what they say, don't assume. When it comes to injuries, when it comes to ligament injuries, when it comes to muscular injuries, when it comes to joint injuries, when we look at the old way of healing, and unfortunately some places are still doing this, the old way of healing was to brace, compress, and not move that injured tissue or joint. This has been shown to not only be the worst possible thing that can be done, but it also has decreases the amount of healing that can actually be done and the percentage that we can get back close to that 100% mark. But it also extends treatment time because of everything that happens when you brace and compact and don't move an injured tissue. Now, let me just be clear, it doesn't mean that we should go out and be moving it just like you would a non-injured tissue. But what they're finding is that some sort of active therapy, some sort of joint mobilization needs to be done, because when we do that, it's going to allow the tissue to heal better, we get better outcome measures, and we have a less chance of having a permanent issue arise from that injury. So what does that mean? Well, if we look at this, here's the best way I can explain this to. When we have any kind of thing we do to where we work out, let's say it's not an injury, let's say we're going to the gym and we're doing a bicep curl, right? We're tearing muscle fiber. Now, because our bicep, when we were doing that bicep curl, we had normal motion and the muscles working, your body goes in, puts immature collagen in there to repair that. But now that immature collagen can turn into mature muscle tissue because we have proper functionality and motion of that muscle. However, if you were to go in and do a bunch of bicep curls and then wrap your arm like this for 3 weeks, what's going to happen is when you unwrap your arm, it's going to be stiffer, we're going to have lost flexibility, and you're actually going to be weaker than you were before because the new tissue there did not mature into normal muscle fiber, it turned into scar tissue. We're trying to keep scar tissue out of these injured joints, injured areas. So I hope that makes sense. Active therapy is extremely important to be done. What active therapy depends on what part of the body is injured and how severe it's injured, but we want to try to get to active therapy and movement type therapy as quickly as possible.